Hi, I'm Angela, and I'm here to tell you that everyone in this audience knows at least one person with cancer. Specialists say it's the biggest epidemic ever seen, and its number keep growing no matter the scientific progress and the incredible momentum of medical discoveries. And you know what? That's not the worst part of this story. If you walk around Mexico City, you will notice that 7 out of 10 people you spot are visibly overweight. Many are young adults or kids, making this scenario even scariest. As an expat coming from a different culture and set of values, I must say that the real problem in Latin America is that obesity and many chronic diseases generated by being overweight for too long are 100% normalized. In Mexico, it's commonplace to have at least one familiar with some kind of cardiovascular problems or degenerative disease. It's common for a man in his 30s to present the first symptoms of diabetes. It's normal for a woman to have kidney stones at her 30s, and sadly, it's too normal to die at 50s for a combination of all these health conditions that modern societies have classified as perfectly normal. This is my dad. He's 70 years old now, and in this photo, he's fishing in the wonderful Bariloche Lake 2 years after being completely recovered from an aggressive type of prostate cancer. You might think he was lucky to survive. Maybe if you're religious, you believe that God saved him, or perhaps it was thanks to the clinic or the great doctor that treated him. But the reality is different. What saved my dad's life was a simple decision to take a lab test when he felt super fine, just to be sure, just in case. This is my dad's friend, Pasquale. They grew up together and shared the same passion for outdoor activities and the local football team. Pasquale got the same diagnosis as my dad. He attended the same hospital, same doctor, same everything, but unfortunately, he died 1 year later. What happened to him? Why couldn't win the cancer? Well, sadly, Pasquale had a late diagnosis and the treatment didn't work as we all expected. My dad wasn't lucky. My dad made a decision to go to a lab and take a diagnostic test even without any red alarms. That's the power of prevention, and that's the power of being on time. Despite medical progress and biotech evolution, clinical lab tests are still the cheapest and most effective diagnostic method. And even if they suck, and we all hate them, it's the right thing to do and the best gift you might do for yourself every year. But there is a big issue with clinical labs in Mexico and Latin America, which help us understand why people skip annual checkups. Because most of the labs are like this. Family-run businesses operating like 30 years ago, lacking automation, charging a crazy amount of money for an outdated service, and delivering paper results that entirely break the patient's experience. Can you imagine for a second how bad it is for a chronic disease patient to do lab tests every month or two and get paper results each time? Can you imagine the experience of visiting a crowded and old-fashioned lab with this frequency? Or the tough situation of millions of Mexicans that need a result on time but who cannot pay for that screening test? And what about their data? Will it be stored in a safe place? Well, this is the typical experience of middle-class patient in Mexico. And why is nobody fixing this? Big consumer brands are gradually improving the patient's experience at their facilities, but they are not tech companies. They still base their service on outdated processes and manual workflows. For instance, their data lives in Excel forms or expensive legacy software, and the way they communicate with their B2B clients and exchange information or results is limited to email and phone calls. We are going to live through a critical time of more frequent pandemics, seeing how public health systems are far too weak, too messy to take care of people's health needs. So it's easy to imagine that the demand for better healthcare services will be growing. And similarly to what happened in the last years in the pharmacy space or doctor space, a huge digital transformation for the lab testing industry is about to happen, pushed by the demand for better patients' experiences and more affordable rates for middle classes. We are building Panda Salud because we want to make people live more, because we want more people like my dad, getting an early diagnosis and extraordinary recovery processes, because it's hard to prevent an illness, but it's even harder to find against it if it's too late. How are we going to tackle this enormous problem? Well, we'll start by transforming any health companies into a lab testing provider, making clinical tests easier to perform and sell for doctors, clinics, and small local labs with low processing capabilities. Our one-stop shop for lab tests simplifies the experience for searching, quoting, and requesting any diagnostic test at the best B2B price. No more need to deal with multiple providers. No more need, to search for tests on other platforms. In just one place, we gather the catalogs from the most important reference labs, digitizing all their data, enabling automated workflows, and making patients' results digitally available anytime a doctor needs them. So, who really needs this? Small labs, they spend a bunch of time and money dealing with multiple providers for all those specialty tests they are not able to process in-house. We are helping them save tons of time and money by transforming their search and manual workflows into a smooth and straightforward experience. Clinics and doctors, they want to monetize clinical tests without being a lab. We help them with on-demand sample collections, plus a dashboard to monitor their sales and keep track of their patients' clinical records and billing cycles. And finally, health tech companies. They are born to make things different, but dealing with traditional lab testing providers is challenging. They look for optimized workflows, real-time communication, and digital results that are easy to integrate into their flows. We are looking for investors willing to reshape the lab testing industry in Latin America by joining this mission of making diagnostic healthcare services cheaper and more convenient for middle classes. We are a team of experienced founders, healthcare experts, and obsessive product people, and we look forward to completing a $600,000 pre-seed round. We are backed by kick-ass investors, and the biggest lab groups are also recognizing our value. We have already tested the on-demand model in Mexico City and Cancun, providing door-to-door clinical tests to over 5,000 people and generating a revenue of $300,000. Now, we are ready to scale this model with a tech platform that will enable any healthcare company to become a lab testing provider in just one day. I've been working at Panda for 2 years, and during this time, I could learn a lot about the main pains and opportunities of this market. As a team, we did a bunch of bad experiments, research, clients interviews, and now we are ready to disrupt this outdated industry with a game-changing platform 100% designed for healthcare providers. We are starting this month with the first 10 beta testers in Mexico City. And we know that a crucial factor for our company to scale will be building the infrastructure to make lab tests available everywhere by connecting multiple providers from different places in Mexico, even remote ones. By the way, this is just the first step. Our dream is to get rid of this and delivering to patients a full digital experience of storing and keeping track of their health indicators, generating a full digital record and processing data from any lab results. So finally, people and doctors will be able to monitor and keep track of specific health indicators a long time and take data-driven decisions. Is this enough exciting to jump on a call with us?